Dr. Connors, welcome. You come very highly regarded.
That's good to hear.
You're from one of the most prestigious hospitals in the country.
Hopefully that's not a problem.
Well, honestly, I have my doubts that a doctor of your experience is going to be satisfied in a small practice. What's to keep you from getting bored and heading right back to the big leagues?
I've always wanted to work in a smaller office where I can get to know my patients better.
Well, you passed that test. That's exactly what I was hoping to hear. I'd like to see my practice continue when I retire, in the right hands.
You hired the right surgeon then. That's been my dream ever since commencement.
Let's get to work. Be sure to check the invoice, because they always seem to forget something. And just a reminder, Krista's going to be off for most of this month with her wedding and her honeymoon.
Krista is the anesthesiologist?
The receptionist. Carol is the anesthesiologist.
Noted. Krista, Carol.
Took me forever to learn how to run this place.
Oh, wow, look at that.
I'm sure you're used to something a little bit more modern.
That is certainly one way of putting it.
Well, welcome to the Wild West of surgery. Small practices can't afford the fancy equipment that the big hospitals get, but we make do.
I could look into upgrading a few things.
Well, I'm always open to improvements if they work within our budget.
I guess there's more to running a small practice than I thought.
Yeah, it's just probably more than you're used to. But this is what it takes to have your own practice.
When is there time to actually perform surgery in between all the admin and managerial work?
I wonder that myself sometimes.
Thanks for coming in, Hannah.
Of course.
Make sure to schedule your next follow-up at the front desk and get plenty of rest.
Okay, we'll do.
Do you have a minute? Can I talk to you in your office?
Something the matter?
Not at all. In fact, everything is great. I am very impressed with your bedside manner. Everyone here has really taken a liking to you.
That's a relief. I thought you might be upset.
Quite the opposite. What I'd really like to offer you is some more responsibilities in the managing of the office, if you think you can handle it.
You can count on me.
Oh, that's what I was hoping to hear. First thing I'd like is to have you do an inventory of our equipment. And Dr. Connors? Everything okay?
Yeah, I'm fine. Do you mind if I have a moment to myself?
Yeah, sure. We'll talk details later.
Absolutely.
Careful with the next incision. You nicked an artery.
We're losing the patient.
Blood pressure's dropping. What are you doing, Hope? Dr. Connors, focus.
Heart rate's dropping.
Dr. Connors.
Patient's going critical. Code blue.
Hope, get a hold of yourself.
I'm sorry.
Save it. Finish the job.
Blood pressure's normalizing.
I saw you lose focus in there.
I know. I messed up. It won't happen again.
No, it sure won't. I've given you a lot of leeway, but I gotta draw a line somewhere.
I can make it up to you.
Hope, I'm sorry. I can't trust you in the operating room, much less with my entire practice. I gotta let you go.